So there's people who are wondering why I recently got RAI. So today I'm gonna talk all about it the best way I possibly can that's easy to understand. And so I wanted to put this out there because I couldn't really find a lot of videos that talks about hyperthyroidism and RAI. So what is RAI? RAI stands for Radioactive Iodine, which is a treatment for hyperthyroidism or overactive thyroid. This could also be a treatment for Graves' disease, which is the common reason for hyperthyroidism and certain thyroid cancers. So patients like me need to ingest a pill or a liquid form of that RAI, which you have nothing to worry about because it's tasteless and odorless. If you've seen my previous video, I had a pill form. So this pill or liquid form contains radioactive isotope of iodine. And if you're wondering why iodine, because naturally our thyroid gland absorbs iodine well. When ingested, it only targets our thyroid cells directly, causing very little damage to the rest of our body. So why did I need the treatment? This is because I was diagnosed with hyperthyroidism without Graves' disease last February this year. I was prescribed with carbimazole for my thyroid and bisoprolol to control my heart rate. I took it for 6 weeks, but then my thyroid gland didn't react to the way we would want it to be. And before my condition will worsen, my doctor prescribed me to get RAI. You're asking, why RAI? Why didn't you just stick to your meds? Or why didn't you get thyroidectomy instead? Upon checking through my ultrasound, there wasn't any nodules or any cysts that were found, which is thank God. And those things are what your doctor is looking for just to make sure that you don't have thyroid cancer. Since there were no nodules or cysts that were found, thyroidectomy is not really an option because it's not only invasive, it's actually useless and costly when you get opened up, and then there's no sample that can be sent to the labs for biopsy, and the oral meds didn't work as it should be, and so the best treatment for me was RAI. So does the dose of your RAI matters? Yes, it definitely matters because the dose of your RAI depends on the success rate of the destruction of your thyroid tissue. As for me, I got 20 MCI and 50 MCI and below is considered low dose. Just for comparison, I saw this girl who had thyroid cancer and was recommended to get RAI after her thyroidectomy, and her dose for RAI was 100 MCI. Because of that, she needed to stay in the hospital for 3 days while I had to stay in the hospital for just 1 day, and she needed to do isolation for 4 weeks or 1 month while I only had to do 2 weeks. So what are the side effects of RAI? So first, there's nausea. So you just have to drink your water slowly so you won't be able to vomit the medication. Then you're gonna have a possibility of salivary gland tenderness. If you remember, I was asked to chew on gummies and sour candies 15 minutes after I swallow the pill, and that is to prevent for the RAI to stay here in my salivary glands, and so it won't cause swelling. Some also experience a change of taste, or they won't be able to taste their food only for a few days or probably a week. As for me, I don't really remember because I love to eat. So far, I didn't really notice that I lost my sense of taste. You're also gonna have dry mouth and dry eyes, but as for me, I didn't have those. And then there's this side effect that I was so afraid of, and I have to ask doc about it because I was so scared that I'm gonna get it right after getting the treatment. And it is backed up with studies, so I was so scared I'm gonna get it, and it's protruding eyes. You know, sometimes when you observe people with hyperthyroidism or goiter and then their eyes are popping out, that's what I'm most scared of because I didn't have that. And so I definitely asked my doctor, will I have protruding eyes after RAI? He said confidently, no, you're not gonna have that. And then he said, if ever it's gonna happen, it's not really as what you think that's worse in your mind. And he said that just in case you're going to experience that, it's not gonna be as worse. And there's also a way to prevent that by taking medications for about 2 weeks. So what are the things that you need to do before your RAI? First, you need to get your labs done as per request by your doctor. For me, I had CBC, TSH, FT4, and ultrasound. Also, on the day of my labs, I have to stop drinking my meds, and it is also recommended to stop drinking your meds 7 to 10 days before your treatment. My doctor also advised me to have low iodine diet for a week. He also recommended me to stop my multivitamins because most of the time it has iodine. And sadly, if you're breastfeeding, you have to stop breastfeeding as well as pumping 6 weeks before your RAI. Also, don't forget to arrange or prepare your isolation room in your house or somewhere else. So what are you supposed to do after your RAI? You have to be aware of your body so you will know if you're developing the side effects that I mentioned. Most importantly, you need to drink plenty of fluids because you need to flush out the iodine from your system. You're going to have palpitations, so you also have to watch out for that. But don't worry, your doctor is going to prescribe you your medication, so it will help with the palpitations. Also, if you're a seafood lover, thank God I'm not, you can resume eating seafood the following day after your RAI. This wasn't mentioned by my doctor, but I searched about it. If you want to continue drinking your multivitamins, you have to resume it 24 hours to 48 hours after your RAI, but make sure it's the type that doesn't contain iodine. Here's the most important part, especially for us women. We are not allowed to get pregnant 6 months to 1 year after the treatment. This is because even after your isolation, radiation still remains in your body, and that causes birth defects and anomalies to your unborn child. So ladies, talk to your husband, talk to your partner, and you have to make sure to plan it well. That's it. I think I've covered pretty much everything already. I hope by now you will be able to tell that RAI is completely different from the radiation that cancer patients go through. Take note, I'm not a doctor, I'm just a nurse by profession who has stopped working as a nurse, and these things you can just easily find online. These are just everything that I've personally experienced and I wanted to share just for more awareness about RAI and hyperthyroidism. But if you have more questions, feel free to message me and I'll try my best to answer them for you. And that's it. Thank you so much for watching and see you again tomorrow. Bye!